Ever wondered why your joints ache more than usual? Could it be rheumatoid arthritis? Rheumatoid arthritis, often simply termed as RA, is a chronic inflammatory disorder that doesn't just affect your joints. In some people, it can also damage a wide variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. An autoimmune disorder, rheumatoid arthritis happens when your immune system mistakenly attacks your own body's tissues. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. The inflammation related to rheumatoid arthritis is what can damage other parts of the body as well. While new types of medications have improved treatment options dramatically, severe rheumatoid arthritis can still cause physical disabilities. Stay tuned as we dive deeper into the causes, symptoms, and treatments of rheumatoid arthritis. So, what causes rheumatoid arthritis? Let's explore. Understanding the causes of rheumatoid arthritis, often abbreviated as RA, requires a dive into the intricate world of the human immune system. At its core, RA is an autoimmune disorder, a condition where the body's protective forces turn against itself. This is akin to a city's police force suddenly deciding to attack its own citizens. A baffling turn of events, isn't it? In the case of RA, the immune system erroneously targets the body's tissues, particularly the synovium, the thin membrane that lines the joints. This assault results in inflammation, leading to the thickening of the synovium that eventually damages the cartilage and bone within the joint. The number of joints affected and the extent of the damage varies from person to person, but the underlying cause remains the same. The body's immune system has gone awry. But what triggers this internal rebellion? Unfortunately, the exact cause remains elusive to scientists. However, they have identified certain factors that could increase the likelihood of developing RA. One such factor is our genetic makeup. Certain genes associated with the immune system can make individuals more susceptible to RA, but having these genes doesn't necessarily mean you'll develop the condition. It's more like having a predisposition or a higher risk. Environmental factors also come into play. Exposure to certain substances such as asbestos or silica can increase the risk of developing RA. Smoking is another risk factor, especially for people who have a genetic predisposition. It's like adding fuel to a fire, exacerbating the risk. Additionally, hormonal influences cannot be ignored. It's been observed that women are more prone to RA, which might be linked to hormonal differences. However, more research is needed to confirm this association. Thus, while the exact cause of rheumatoid arthritis remains unknown, a combination of genetics and environmental factors seem to play a crucial role. It's like a complex jigsaw puzzle, with each piece contributing to the bigger picture. The more we study, the more pieces we find, gradually unveiling the enigma that is rheumatoid arthritis. Now that we know what causes rheumatoid arthritis, what are the signs to look out for? Rheumatoid arthritis, also known as RA, is a complex condition with a myriad of symptoms that can vary greatly from person to person. These symptoms often go beyond the joints and can affect the whole body. One of the most common early signs of RA is experiencing tender, swollen joints. This is usually most noticeable in the small joints of the hands and feet. These joints may feel warm to the touch and may even appear visibly swollen. It's also common for this tenderness and swelling to affect the same joints on both sides of the body, which is a distinctive feature of rheumatoid arthritis. Another common symptom is morning stiffness. This isn't just the standard stiffness you might feel after a poor night's sleep. It's a profound stiffness that can make it difficult to get out of bed and start your day. This stiffness typically lasts for at least 30 minutes, and in severe cases, it can linger for several hours. Fatigue is also a significant symptom of rheumatoid arthritis. This isn't just feeling a little tired after a long day. It's a pervasive tiredness that can make even simple tasks feel like monumental challenges. Some people with RA may also experience fever. This is not typically a high fever, but rather a low-grade, persistent fever that just won't seem to go away. Weight loss is another symptom that can sometimes occur with rheumatoid arthritis. This is usually unintentional weight loss and can be a result of the body's response to the inflammation caused by RA. It's important to remember that these symptoms can vary in severity and may even come and go. You might have periods of intense symptoms known as flares, followed by periods of relative calm known as remission. Being aware of these symptoms can help you seek timely medical attention and manage the condition better. Understanding these signs can help you to recognize the onset of rheumatoid arthritis. allowing you to seek medical advice and start treatment as soon as possible. How do we fight rheumatoid arthritis? Is there a cure? These are questions that many people ask when faced with this chronic inflammatory disorder. While a cure for rheumatoid arthritis is yet to be found, there are ways to manage its symptoms and improve the quality of life for those living with the disease. The treatment for rheumatoid arthritis is multifaceted, involving a combination of medication, physical therapy, and, in some cases, surgery. The goal is to minimize symptoms, prevent joint damage, and maintain or improve physical function and quality of life. Medication is often the first line of defense. Disease-modifying anti-rheumatic drugs or DMARDs are commonly prescribed. These medications can slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. Non-steroidal anti-inflammatory drugs or NSAIDs can help reduce pain and inflammation. Corticosteroids like prednisone can also be used to control severe symptoms while waiting for DMARDs to take effect. Physical therapy is another crucial part of treatment. A physical therapist can teach exercises to keep joints flexible and improve muscle strength, which can help reduce pain and fatigue. Assistive devices like canes or walkers can also be recommended to help with mobility and protect the joints. In severe cases, when medication and physical therapy don't provide enough relief, surgery may be considered. Procedures can range from synovectomy, where the inflamed lining of the joint is removed, to total joint replacement. The aim of surgery is to restore function to the damaged joints and relieve pain. Even with these treatments, managing rheumatoid arthritis is not a one-size-fits-all approach. What works for one person might not work for another. Therefore, it's essential to work closely with your healthcare provider to find the best treatment strategy for you. Remember, early detection and timely treatment can help slow the disease progression and prevent joint damage. So, don't delay seeking help if you suspect you might have rheumatoid arthritis. With the right treatment and support, you can continue to live a fulfilling life despite the challenges of this disease. In this journey, we've learned a lot about rheumatoid arthritis, haven't we? It's been an enlightening exploration, and as we wrap up, let's revisit the highlights and pull together the threads of our discussion. First, we took a deep dive into what rheumatoid arthritis actually is. We discovered that it's a chronic inflammatory disorder, which primarily affects the small joints in your hands and feet. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in joint deformity and bone erosion. Then, we moved on to the causes of this complex condition. While the exact cause is unknown, it's believed to be a combination of genetic and environmental factors. Certain genes may make you more susceptible to environmental factors, such as infection with certain viruses and bacteria, which could trigger the disease. We also discussed the symptoms of rheumatoid arthritis, which can vary from person to person and may change in severity over time. The most common symptoms include tender, warm, swollen joints, joint stiffness that is usually worse in the mornings and after inactivity, fatigue, fever, and weight loss. Our conversation then turned to treatment options. While there's no cure for rheumatoid arthritis, a combination of treatments can help manage the symptoms and slow the progression of the disease. These include medications to reduce inflammation and pain, physical and occupational therapies, and in some cases surgery. Throughout our discussion, we've underscored the importance of early detection. Recognizing the symptoms and seeking medical advice promptly can help to manage the condition effectively and prevent severe damage to your joints. Remember, your health is in your hands. Stay informed, stay healthy. Knowledge is power, and the more you know about rheumatoid arthritis, the better equipped you'll be to manage it. So, continue to educate yourself and others, and together, we can make a difference in the lives of those affected by this condition.